Hi, I am Dr. B. Mahendra Varma, Consultant Surgical Oncologist at Kaizen Oncology, Hyderabad. Today we will be discussing about different aspects of surgery in oncology, that is open surgery, laparoscopic surgery and robotic surgery. Like what are the advantages of open surgery, when to choose an open surgery, what are the advantages of laparoscopic surgery and when we give option for laparoscopy, and what are the advantages of the robotic surgery. So still open surgery is still standard of and can be offered at any cancer surgeries, but with advancement of technology, that is laparoscopic and robotic, where minimal access has come up, that very small incisions and less pain and early discharge, majority of cancer surgeries have come up to laparoscopic and robotic surgeries. So when do we offer open surgeries? When there is complex resections involved, or when there are multivisceral resections involved, where you think laparoscopic and robotic might not give complete oncological clearance and there is risk of patient life. In those patients we offer open surgery. So open surgery is still best for visualization, where you can visualize the entire abdominal cavity at one go and you can access all areas. Whereas disadvantages of open surgery are again longer incisions, more operative time, more blood loss and more pain to the patient. Coming to again laparoscopic surgeries, majority of oncological surgeries, whether it may be GI surgeries or gynecological surgeries or liver related surgeries, even pancreatic surgeries, can be offered laparoscopically. Again, we have to choose laparoscopy or robotic surgeries based on the location of the cancer, how the surgery can be planned and outcomes of the patient. It is not that you offer laparoscopy and robotic to all patients. So advantages of laparoscopy are again smaller incisions, lesser pain, lesser blood loss, early recovery and early discharge. So what are the disadvantages of laparoscopy? In laparoscopy the instruments are rigid. In laparoscopic instruments you don't get the dexterity of the as compared to the open or in the robotic arms. Again the vision is 2D vision. Again prolonged surgeries, because oncological procedures are long procedures. There is chance that both the assistant and the surgeon might get fatigue after a particular period of time. In certain patients, there is advantage of robotic surgeries. Again, robotic surgeries, what is the advantage you have? It is a 3D vision. The dexterity of arms are better. Like as you move the wrist in open surgery, similarly, robotic arm gives that dexterity with the robotic arms. And you can access difficult areas, complex areas, deeper areas where you think you are not accessible in the laparoscopic procedures. Again, for anastomotic part, in difficult liver resections or hepaticojejunostomies or difficult pancreatic resections, robotic helps in doing anastomosis better, so that patient outcomes are better compared to the lab. This robotic helps in giving better advantage in these complex procedures. The most advanced you can see in pelvic surgeries, again in partial nephrectomies, robotic has a bigger role compared to the laparoscopic procedures. So what are the disadvantages of robotic? Main disadvantage of robotic surgery are cost and availability. So how to choose a patient for whether it is open or laparoscopic or robot? So for a patient, when you are choosing for oncological surgery, the main goal of a surgery is to give complete oncological clearance and prevent recurrence and give the better outcome to the patient. So whether you choose open or laparoscopic or robotic should not be decided based on the availability of resources, but should be on how, what type of cancer is it, where are you operating, and what are better outcomes can be given to the patient. So for any further updates on gastrointestinal surgeries or gynecological or urological cancers for both open or minimal invasive, you can follow on Kaizen Oncology. I'll be updating further any other further updates there. Thank you.